The mental health conditions that are most prominent in men are very similar to what you see across the general population. However, men may present differently than women. So with depression or anxiety, for example, whereas very often the typical picture is that somebody will withdraw or they'll look sad, they'll be crying. What we very often see for men is that they will be angry or irritable, act out, use substances at a higher rate. And so that's kind of the difference in presentation, even though the underlying diagnosis may be the same. It's important to really work on encouraging men to be more verbal about what they're going through. Traditionally, men and boys have been acculturated to be tough, to not talk about things, to kind of grit your teeth and bear it. And this has really not served us very well in taking care of our mental health. While there have been a few high-profile cases of men that have been very verbal about their mental health, Senator John Fetterman, Dwayne "The Rock" Johnson, Jay-Z, many have not, and that's not kind of the typical presentation. And so, really making it okay to talk about what you're going through, having one or two trusted friends that you feel that you can confide in, and as a trusted friend, being okay with, number one, listening in an open fashion, and number two, helping to get that person to the assistance that they need is very important. There are multiple cultural aspects to men's mental health, and I think that you also see them take place within kind of the larger context of different variations in how cultures either talk about emotional and mental health needs or the experience of those needs. So as an example, in my community, African American community, we very much have traditionally looked at emotional needs and mental health issues as kind of a spiritual weakness, something that you don't talk about within the family. Yet, interestingly, we all kind of know that we have folks that have mental health needs in the family. And so we see those same issues kind of going across, not just different cultures, but also that gender gap as well. Eating disorders are on the rise in men because there has been kind of an explosion of this kind of workout and physique culture that is really driven by social media. And so to some extent, eating disorders probably have been prevalent in men for quite some time and just not really talked about. If you think about some sports where there's a perception that being of a certain weight or a certain body type provides for better performance. So if you think wrestlers or boxers, other types of fighters that like to cut weight before a fight in order to kind of be in a different weight class, they experience very disordered eating, and so it really lends itself to developing a full-blown eating disorder. And so kind of that added to the pressure from social media to have a certain body type with very low body fat, very extreme cut musculature, I think is leading towards the increase in eating disorders in men and boys. As a dad of 3 children with a range in ages from a son who just finished up his freshman year at college all the way down to a 7-year-old daughter, I think that being a father has definitely changed me from an emotional standpoint. Matter of fact, I just told somebody yesterday that I still to this day cannot watch The Lion King without shedding a tear or two. And so it has this great, vast effect on kind of the way that you see yourself and your responsibility in the world. And so, on some level, we carry that weight on our shoulders as fathers, but at the same time, we have to be emotionally present for our children. We have to be able to kind of show them and lead by example and model the emotional behavior that we want to see in them. And so I've gone to great efforts to kind of take the lessons that my father, my parents instilled in me, to think about what worked well and what didn't work well, and to take that and do things slightly differently with my kids to have kind of a better emotional relationship with them, between me as the parent and them as the child, and also so that they, as they grow up, are more able to talk openly about their emotional needs.